Good morning. My name is Sajid Jalil. I'm a clinical associate professor at The Ohio State University. On behalf of my co-authors, I'm going to present this poster, which was presented at the DDW 2023 last May. The title of this poster is Post-Transplant Outcomes of Liver Transplant among super obese recipients, BMI more than 50. To give you background in AIM, body mass index in most transplant centers is a consideration for liver transplant listing due to concerns for technical challenges and post-transplant outcomes. Case series on liver transplant among super obese patients, that is BMI more than 50, have shown conflicting data. We sought to examine post-transplant graft and patient survival of liver transplant recipients who are super obese. Methods. Using the UNOS database, obese liver transplant recipients BMI more than 30 since 2002 were stratified for BMI as 30 to 39.9, BMI 40 to 49.9, and BMI more than 50. BMI was calculated after adjusting 5% weight for moderate and 10% for severe ascites. Super obese recipients were matched with the other two groups using propensity score matching for age, gender, race, diabetes, and MELD score. Results of 125,406 liver transplant recipients, 31,813 liver transplant with BMI more than 30 and complete data were analyzed. Of 113, which is 0.36%, super obese BMI more than 50, 104 could be matched with 1,040 recipients with BMI 30 to 39.9, and 828 recipients with BMI 40 to 49.9. Results. At baseline, cohorts were similar, except super obese cohort compared to recipients with lower BMI were younger, females, and with higher MELD. On a mean follow-up period of 314, 301, and 275 days after liver transplant in 3 respective BMI categories, super obese recipients had lower graft survival and patient survival. Both were statistically significant. On a multivariate Cox model, super obese versus the recipients with BMI 30 to 39.9 had worse graft and patient survival, with the respective hazard ratio of 1.9 and 2.1 for both. Hemodialysis at transplant was associated with worse outcomes, while the outcomes were better over time. Causes of death were similar in the 3 groups of BMI. On the right, you can see the 2 graphs with graft and patient survival. The panel A shows survival probability with graft survival. Patients with super obese are shown in green, and you can see the survival curve shows a lower survival rate for super obese patients. Similarly, on panel B, y-axis shows survival probability, where x-axis shows patient survival. Super obese patients cohort is shown in green, and again, patient survival in super obese patients is lower compared to the other 2 cohorts, and again, statistically significant. Table below shows results of Cox proportional hazard regression models for variables associated with graft survival and with patient survival. You can see from the table that recent time period had improved graft and patient survival. BMI more than 50 was associated with higher graft and patient survival, and recent dialysis at transplant was associated with higher, and recent dialysis at transplant was associated with worse graft and patient survival. Conclusions. Liver transplantation among super obese, BMI more than 50, patients is negatively associated with post-transplant graft and patient survival. Strategies are needed to optimize candidate selection and to optimize post-transplant outcomes among candidates with end-stage liver disease who are super obese. Thank you for your attention.